Don't think for a second that Zach's story is unique because he's a high-level athlete. In fact, he was complaining of the same thing that most of my other patients complain of.
I've suffered with back pain for a really long time, like for 2.5 years, and I've gone to doctor after doctor and had injection after injection and tried this and tried that, and chiropractor and physical therapy, and some days I could barely walk and some days I was good enough to keep moving, but it was, on the worst days, it was pretty bad.
Patients who have degenerative discs will reliably explain their pain the same way. They'll say that when they get up from seated position, like from the car or from their bed in the morning, they have this feeling like they're leaning over and it takes them a little while to stand up straight. Patients who have degenerative discs will say that when they sit at the table that they have to keep fidgeting and changing positions often. They'll say that when they're standing in line at the cashier, when they stand, they don't like to stand flat. They like to sort of shift their weight and put their hands on some support. Patients who have degenerative discs that are affecting their nerves also have pain going down their legs. So whether it's the back of the thigh, the side of the thigh, or whether the foot is involved or not, that's all nerve pain. And that's really probably the most debilitating about this syndrome. The good news is that it's a lucky thing for me to be alive in 2024 when, as a spine surgeon, I can offer patients motion-preserving technique and disc replacement. We know for a fact that with disc replacement, you avoid the same issues that you get from a fusion. Many patients come to me and tell me, well, my surgeon told me that I'm not a candidate for a disc replacement. And I find that a lot of the older generation surgeons who haven't been trained in disc replacement will sort of poo-poo that option, and they'll come up with a bunch of esoteric reasons of why disc replacement is not possible. Frankly and humbly, I beg to differ, and I'm not basing it just on my experience. I'm basing it on good studies, good quality studies. So if you have back pain when you get up and you're tired of managing it with physical therapy, chiropractic care, or any other conservative means that doesn't seem to be working for you, I would highly advise you to obtain an MRI and get a second opinion. I hope this helps.